Stop giving your child antibiotics for ear infections until you watch this video. As a chiropractor who's helped hundreds of children overcome chronic ear infections naturally, I need to share something critical about why the infections keep coming back. Here's what most parents don't realize about chronic ear infections. It's not actually about the infection itself. It's about a hidden problem in your child's body that most doctors never even check for. And I've spent years helping children overcome chronic ear infections without drugs or surgery. And what I've discovered will probably surprise you. In fact, a landmark study in the Journal of Clinical Chiropractic Pediatrics showed that 93% of children with chronic ear infections improved with this natural approach, many within just 10 days, and the majority without needing another round of antibiotics. In the next few minutes, I'm going to show you why antibiotics and tubes often fail to solve the problem, the real reason your child keeps getting ear infections, how a simple, gentle adjustment can help restore a proper drainage, and most importantly, how to help your child's body heal naturally. But first, let me explain something crucial about your child's ear anatomy that changes everything. Let me take you inside your child's ear for a moment. Inside each ear is a tiny but crucial drainage tunnel called the eustachian tube. Think of it like a natural drain pipe that connects the middle ear to the back of the throat. Its job is simple but vital: to equalize pressure and drain fluid from the ear. But here's where it gets interesting. In babies and young children, this tube is actually built differently than in adults. It's shorter, it's more horizontal, and it's also narrower. This is why children are so much more susceptible to ear infections in the first place. When this already compromised draining system gets blocked or fluid builds up, creating the perfect environment for bacteria to thrive. But here's what your pediatrician probably hasn't told you. The real problem often isn't the bacteria, it's the compromised drainage system. Now, this is where things get really fascinating. What most medical professionals don't assess is how your child's nervous system controls the muscles that open and drain the eustachian tube. There's a specific muscle called the tensor veli palatini that's responsible for opening this drainage tube. This muscle is controlled by a cranial nerve that originates from the brainstem and travels through the upper cervical spine, specifically in the top 3 vertebrae in your child's neck. If there's even a slight misalignment in this area, what we call a subluxation, it can impair the nerve signals sent to that muscle. So think about it like a kink in a garden hose. The water's still trying to flow, but that kink is restricting everything. And that's exactly what can happen with your child's drainage system when there's pressure on these nerves. Eustachian tube's function is closely related to the position and tone of the upper cervical spine, especially in children. When there's mechanical tension in this area, it directly affects how well those tubes can drain. Let me share a real example. Last month, I had a mother bring in her 4-year-old daughter who had suffered from 6 ear infections in just 5 months. She was scheduled for tube surgery the following month, and after examining her, we found significant tension in her upper cervical area. Using very gentle, specific adjustments, no cracking or popping involved, we were able to restore proper nerve function to her drainage system. And within 2 weeks, her ears were draining properly for the first time in months. She hasn't had an ear infection since, and they were able to cancel the surgery. Now let's talk about why antibiotics and tubes often don't provide lasting relief. Antibiotics can certainly kill bacteria, but they don't address why the bacteria were able to thrive in the first place, the drainage issue. It's like constantly mopping up water from a leaking pipe without fixing the pipe itself. As for tubes, while they can provide temporary drainage, they come with their own set of risks and potential scarring, hearing loss, and the need for repeat procedures when they all fall out. Plus, they're treating the symptom, not the cause. When a child comes to our office with chronic ear infections, we take a completely different approach. Using a gentle pediatric-specific technique, we assess and adjust the upper cervical spine. These adjustments are so light that most children sleep right through them. And these specific adjustments help restore normal nerve signaling to the drainage muscles, reduce inflammation in the cervical lymphatic regions, improve fluid movement through the eustachian tube, and allow the body to do what it's designed to do: clear infections naturally. The results speak for themselves. And a study in the Journal of Clinical Chiropractic Pediatrics showed that 93% of children with chronic ear infections improved with chiropractic care, and many within just 10 days, and most without even needing another round of antibiotics. Beyond just the ears, what's even more exciting is that parents often notice other improvements too. Because we're working with the nervous system, many children experience better sleep, improved immune response, fewer sick days, enhanced mood and focus. And this makes perfect sense because when we remove interference from the nervous system, the entire body functions better. Here's what I want you to take away from this video. Ear infections are often a symptom of poor drainage and nerve dysfunction, not just a bacterial problem. By addressing spinal alignment, we help restore proper function so your body's ability to heal will improve and they can stay well naturally. If your child has had more than 3 ear infections this year, it's time to try something different. A gentle, no pressure evaluation could reveal if nerve interference is contributing to these reoccurring infections. In my next video, I'll show you exactly what to look for in your child's posture that could indicate they're at risk for chronic ear infections. Click the video on the screen now to learn these crucial warning signs every parent needs to know.